Let's talk about the difference between how ADHD looks in a man versus a woman. My name is Dr. Ruth Dotton. I'm a board-certified adult psychiatrist, and I promote neurodivergent affirming concepts on this app. And we know that ADHD can look very different in men and women. So first, we know that males are much more likely to get a diagnosis of ADHD early in life, and that women are going to get that diagnosis later in life. As we age, however, the discrepancy in diagnosis between men and women gets much narrower, and so there's not a big difference in terms of adult males and females who have ADHD. Now, we don't fully understand why this happens, but it may have something to do with the fact that women seek mental health care for other internalizing symptoms, which we'll talk more about later, or the fact that hyperactive symptoms tend to get better as we age, and so fewer men are being picked up later in life because they don't have these hyperactive symptoms anymore. Now, I'm going to speak in large generalizations, so please forgive me. Of course, this is not going to be true for all men or for all women and AFAB. So generally, males are going to present more consistently with hyperactive symptoms, whereas females are going to present more with inattentive symptoms. This means that boys are much easier to pick up because of their externalizing symptoms. This is going to be things like being hyperactive, disruptive, running around, and talking excessively. And this is in comparison to females who have more internalizing symptoms. So this might look like inattention, memory issues, problems with organization, daydreaming, and low self-esteem. So because of the difference in these behaviors, the males tend to get their diagnosis earlier. So for men, this could look like hyperactivity, disruptive behaviors, frequently losing things, interrupting others, getting aggressive or defensive, engaging in high-risk behaviors, having angry outbursts, and being insensitive. In contrast, for women, this might look like a lack of motivation, being disorganized, forgetful, and often late, being impatient, having a sense of inadequacy and overwhelm, easily losing focus and daydreaming, hypersexuality, repetitive behaviors like nail biting or skin picking, emotional dysregulation or shyness, perfectionism, and somaticizing, meaning that they get physical symptoms from the anxiety that's associated with their ADHD symptoms. Also, we see that fluctuations in hormones that occur naturally for a woman, like during her menstrual cycle and perimenopause, are also going to be associated with an exacerbation of their ADHD symptoms. And as we age, this tendency for males to have externalizing behaviors and females to have internalizing, that continues. And we can see that with the associated comorbid psychiatric diagnoses that they might carry. So men are going to be more likely to have issues with substance use or personality disorders, whereas women are going to be more likely to struggle with things like anxiety, depression, low self-esteem, and eating disorders. If any of this resonated with you, or maybe there's something that I said that you feel like is just not true, I'd love to hear about it. Please share in the comments below. Wishing you all good mental health today, and I'll see you in the next one.